Hello, my name is Ashley Darling and I'm a PhD student at UTA. Today I'm presenting on the influence of current depressive symptomology on cerebrovascular function in young adults with major depressive disorder. So to start, major depressive disorder, which I'll refer to as MDD from here on out, is episodic in nature and highly recurrent. Importantly, MDD is directly linked to an increased risk for cerebrovascular disease and neurocognitive deficits. In older adults with depression, cerebral vasodilatory responsiveness to hypercapnia, which is an index of cerebrovascular health, is blunted. In young adults with MDD, peripheral vascular dysfunction is evident and graded in relation to symptom severity. However, whether active depressive symptomology influences cerebrovascular function in young adults has not been examined. Therefore, we hypothesize that adults with symptomatic MDD would have blunted cerebral vasodilatory reactivity to a hypercapnic stimulus compared to young adults with MDD in remission, known as euthmic MDD. So all participants were classified using the Mini International Neuropsychiatric Interview. 8 adults with symptomatic MDD had current clinically significant depressive symptoms, and 8 adults with euthmic MDD were in remission for at least 2 weeks. The Patient Health History Questionnaire 9 was used to assess depressive symptom severity. A reference group of 14 non-depressed healthy adults were also included. Mean arterial pressure, middle cerebral artery blood velocity, end-tidal carbon dioxide concentration, and internal carotid artery velocity and diameter were measured at baseline and during a rebreathing-induced hypercapnia task. Cerebrovascular conductance index and internal carotid artery conductance were calculated at baseline and the highest common magnitude of hypercapnia, which was delta 9 torr. So now for the results. As seen in figure 1, hypercapnia elicited increases in middle cerebral artery velocity in all groups. However, mean arterial pressure only increased in the healthy adult group. In figure 2, hypercapnia elicited increases in conductance index in all groups, and these responses were not different between groups in the internal carotid artery, but cerebral vascular conductance index was blunted at hypercapnia in the symptomatic MDD group when compared to the healthy adults. So in conclusion, these data indicate a 10% reduction in hypercapnia-induced vasodilation in the middle cerebral artery, but not the internal carotid artery in adults with symptomatic MDD. This suggests that active depressive symptomology influences cerebrovascular vasodilatory function in otherwise healthy young adults.